Hello and welcome everyone. Thank you all so much for coming. My name is Aaron Spear and I'm a healthcare intern with CalPERG. Today we are here to present our report, which is Uncovered, How the Healthcare System is Failing Young Californians. Also here to join me is Lauren, who's going to read personal statements from UC San Diego students on healthcare. The healthcare reform debate has been seized headlines throughout California. But one of the voices that has not been heard is California's young students and young people. As our new report documents, young people are at the forefront of the healthcare crisis, and making a system that works for them is a crucial piece of reform. The findings in our report paint a kind of stark picture. You see, Americans aged 18 to 24 are most likely to actually go without health insurance. Even 20% of college students go uninsured. And on graduation day, that doesn't change. Of the new graduate population, aged 23 and 24, 38% go without health coverage. That's because California is one of the states that allows insurers to drop young people off their parents' plans after graduation. That means on graduation day, many people are added to the lines of the uninsured. After finding a job or joining the workforce, that doesn't help either, because only 1/2 of young people receive health care from their employers. Some say that young people think they're invincible, therefore they opt out of health insurance. But from reports we've received while writing this report, we found that college students want health care coverage. But the problem is that they often can't access it, or it's unaffordable, because every piece of the system makes it very hard for college students to access health insurance. And as our report documents, the consequences of going without coverage can be dire. 2/3 of the uninsured young people will go without necessary health care because of costs. And those that do opt for health care often find themselves facing huge amounts of debt. On average, age 18 to 34, those that face that type of debt face an average of $13,000. And the fact is that this strains students and often forces them to drop out of college. In fact, the University of California found in a report that they released before requiring students to have health insurance, that healthcare debt is the #1 reason that students drop out of college or stop studying. That's why healthcare reform is so crucial. If we stay with the status quo, that will mean more California students will realize they don't have the money to get health coverage. Fewer and fewer employers will be able to offer their employees health benefits. And finally, more and more students will be forced to drop out of college because of medical debt. And rising medical costs continue to take their toll. And eventually, it is our young people that are going to be footing the bill. As bad as things are now, they're only going to get worse. Our system is failing an entire generation. That's why we are so glad that Congress and our leaders in Congress are working with common sense reform to help make healthcare affordable and bring down rising healthcare costs. The bill passed by the House of Representatives actually made it so that students could stay on their parents' plans for longer. And the creation of insurance exchanges and public health insurance options will give young people more choices to access affordable, quality coverage. Now we're calling on Senate to do the same, to stand up and push for reform. California's students and young people need reform now. Thank you. And I'll open the floor to any questions if anyone has any. Okay, well, if not, here's Lauren. She'll present a few personal statements.
Hi, so these are healthcare horror stories that we collected from everyday students on campus. The first story we have is from a college student named Nancy. Nancy's 20 years old and goes to Warren College. Nancy writes, "My dentist told me that my health insurance would cover my wisdom teeth extraction, and all I would have to do is pay about 1/3 of the bill as a copay. However, after the wisdom teeth extraction, my dentist informed me that my insurance ended up not covering my medical fees, so so I had to pay an extra $900 on top of already paying 1/3 of the total bill. Our next story is by a student named Haley. She's 22 years old and is also a college student here. She writes, "I will be turning 23 next year and will have to pay for my own health care. I will be taking out loans for school, and I don't know how I will be able to afford health care. I need health insurance because of carpal tunnel and a bad neck. I hope it can be realistically priced with good coverage." A next student that we found, Daniel, writes, "I reapplied as a student with my parents' insurance, and there was a typo by an employee, and I was dropped from the plan for 3 whole weeks. It took 3 weeks to put me back on the plan, even though none of it was my family's fault." And our last story is by a student named Cindy, age 21. She writes, "When I was a little girl, I got into a car accident and the ambulance had to take me to the hospital. After the whole ordeal, the insurance company would not pay for the ambulance fees, which amounted over to $1,000 my family had to pay."
Okay, well, thank you all so much for coming. We really appreciate you all showing your support.